My name is Ashley Higgins. I'm a clinical nurse specialist for the Neuro Division at CMC Maine, and I've been with Atrium Health since 2014. A typical recovery for spine surgery patients, depending on the patient, is generally about 3 to 5 days, and that's also dependent on level of complexity. Some key milestones we look for in successful recovery is, of course, number one, pain management. Before you go home, we want to make sure that your pain is controlled. We also want you to have a bowel movement, be able to go to the bathroom well. We definitely want you moving around before you go home. Those are probably the key milestones. Before surgery, we set expectations using our really awesome preoperative spine class that is taught by our clinical nurse leaders, and that goes over all sorts of different things, the process through the hospital, what to expect before and after surgery, and also what to expect going home. Probably one of the biggest misconceptions patients have is that there will be zero pain after surgery. And while there will be some pain, we really do our best to use different therapies to manage pain. So it may not be zero, but we will manage it to the best of our abilities. After surgery, patients are often surprised by how much pain there is. So again, going in knowing that there will be some pain, but we will do our best to manage it. And some other things patients are often surprised by is that we're going to ask you to get out of bed probably the day of surgery, and that really is one of the best things you can do for your recovery and for pain management as well. So there are a few complications that can happen after spine surgery. They won't necessarily happen, but there are some things that we're going to ask you to do to mitigate those complications. So getting out of bed and moving helps prevent a lot of things like potential pneumonia or an ileus. It also, believe it or not, helps with pain. So really mobility is kind of a magic intervention that we like to have patients do after surgery.